Secrets of a Successful Cardio Sleep Program. At Advocate Aurora Health, sleep specialist Yelena Tumashova, MD, and cardiologist Alan Brown, MD, implemented sleep apnea screening across cardiology. 3 years in, the program has led to thousands of cardiac patients being treated for their previously undiagnosed sleep apnea. Before the program began, patients who were admitted to the ER with shortness of breath and hypoxia would routinely be diagnosed with recurrent heart failure. But Brown and Tumashova noticed that these patients' cardiac testing results would often show normal left ventricular function. What was amiss with these patients was snoring and apneic spells. "We knew right away this was not heart failure," said Brown. At the time, all the two physicians could do was speculate that many of the readmissions for cardiac issues were actually due to undiagnosed sleep apnea. "We do a lot of unnecessary therapies because of the lack of diagnosis of sleep apnea. As a cardiologist for 30 plus years, I've been acutely aware of this." But most patients and most cardiologists were not motivated to do sleep testing to catch the sleep apnea earlier or at all. Tumashova had been conducting some inpatient sleep studies with Zolpidem's WatchPat home sleep test, and she and Brown decided to invest in the technology to make more diagnoses. Having cardiology start the conversation and dispense the home sleep test has proven to be critical to the program's success. Previously, when told to call the sleep department for the test, patients wouldn't even pick up the phone to make the most basic step of the referral, Tumashova says. Since the program began 3+ years ago, all the system's cardiologists have joined. More than 2,300 patients have been recommended for sleep studies, and 80% of those have followed through. More than 75% of those were found to have sleep apnea. After diagnosis, the sleep clinic takes over care and follow-up. It sees between 800 and 1,000 patients each month, including the increased referrals from cardiology and an increase in self-referrals. Tumashova also credits this success to a multidisciplinary approach to treatment. Beyond CPAP, the sleep specialists now offer more options, including oral appliances, implantable neurostimulators, and other alternatives. Multiple modalities brought a lot of patients back to us, she says. Brown offers these 3 tips for building strong cardio sleep programs. 1. Have dedicated leadership in cardiology. 2. Have a strong sleep program dedicated to aggressive patient follow-up. 3. Have a solid partnership between cardiology and sleep department personnel. Get all the details of this program at www.sleepreviewmag.com/sleep-disorders/cardio-sleep-program.